the breasts look round and beautiful almost immediately compared to under the muscle that tends to have like a boxier appearance for a while until that.
And it's really been revolutionary to be able to offer patients who have had implants in the past a whole new look with a lot less pain after surgery.
But I've been amazed by this technology and how natural it looks, even with minimal breast coverage.
We have 6th generation implants so that it looks great, it feels great, it doesn't move, and patients aren't really in that much pain afterwards.
The beauty scientists, Dr. Kristy Hamilton and Dr. Roy Kim. Real beauty without the hype.
This is Dr. Roy Kim, one of the members of the Beauty Scientists. I'm here with my wonderful partner here, Dr. Kristy Hamilton. How are you, Kristy?
Great. Always so great to see you, Roy. I'm excited for our episode.
Yes, because we're going to be talking about a very hot topic, which we both love, preservation breast augmentation. So it sounds very contradictory. Like, what are you preserving if you're doing a breast augmentation? What's interesting is that better anatomy knowledge, like better surgical dissection, as well as these awesome implants, Motiva breast implants, can we preserve function of the breast? And the answer, I think, is yes. So generically, how would you define preservation breast augmentation?
So I think we're living through, in America at least, a breast augmentation revolution. I feel like we're rethinking how we have viewed this operation. And so preservation breast augmentation to me means that we are maintaining the structures of the breast. And when we are considering implants for patients, we are placing them in a way that we are doing a breast implant as opposed to a pec muscle implant. So we're preserving the muscle. We're not cutting it. We're sparing it. We are augmenting the breast tissue and going in this special plane that we'll talk about. And we now have technology that really lends itself to this. So we're going for a very natural look and one that is very compatible with the modern woman's lifestyle. So these are Pilates moms on the go, or they're having their very first breast augmentation and they're 20 and they just want something super natural and get right back to life.
Yeah, I totally agree, because our understanding of the breast, we've always had it, but we haven't been able to come with the best solutions, and now we can. So as a quick background, of course, you have skin, breast tissue underneath, then you have muscle. So classically, what we've wanted to do is sort of get natural breast augmentation sort of in the breast tissue. Because of different issues with like sort of the breast implant shell, we've actually had to usually place them under the muscle, which if you think about it, anatomically is not natural. Now we've had great results, but there were some issues, including you have to place it under the muscle, stretch the muscle, cut the muscle, and the implant itself had some risk of scar tissue formation around the actual envelope. With under the fascial placement, we're actually able to place 6th generation implants right where the breast tissue is. So if you wanted to elaborate that on like a new pocket as well as these 6th generation Motiva implants.
Yes. So the fascia is the covering of the muscle. So we're in front of the muscle, but behind the fascia of it. And so we get the benefits of that strength layer. We also have a clear demarcation between the muscle, the implant, and the breast, which I think is very helpful and important for a couple of different reasons. And now with the advent of the Motiva implants, this is really exciting because around the world, they've had access to newer technology, not just Motiva, but a number of different implant options that do very well in this plane. And we have lagged behind a little bit in the United States. So I agree with you. We've had really beautiful under the muscle results, but especially longer term, there's some downsides to that. Movement of the muscle, women are not just still before and afters. We're bodies in movement. And so some of these before and afters look really beautiful, but when patients are moving or pressing on their hips or firing their pec muscle, we see those implants move because they're behind the muscle. So now that we can go in front and we have technology that looks really great, even under less tissue coverage, we can kind of catch up with the rest of the world, because globally, and you're the one who initially turned me on to this, globally, implants are much more likely to be placed in front of the muscle than behind.
Yeah, I mean, I've talked to a lot of my friends in basically all over the world, Europe, South America, Asia. Motiva implants have been out earlier than in the US, so that's what caught my attention. The surgeons love them and the patients love them. So, with a different shell, better fill, so there's less rippling and wrinkling, we're able to put it safely under the fascia, more natural position, no need to cut the muscle or place it under the muscle. At least for my patients, I found that they've had less swelling, less bruising, definitely a lot less pain because it's under the fascia. And so they're able to get back to life. And I do think that a lot of female patients are much, much more into athletics, getting back to life a lot sooner. I don't know how you feel about that.
100%. I let my patients go back to full exercise if it's a simple breast augmentation at a week. So that's completely different than what I used to tell patients when we were cutting their muscle and that would need some time to heal. So I think it's very compatible with their lives. The breasts look round and beautiful almost immediately compared to under the muscle that tends to have like a boxier appearance for a while until that muscle relaxes. And patients are amazed by how good they feel. And they're out to dinner that night and just, back chasing after their kids or doing their yoga workouts just in a matter of days.
Yeah, so patients definitely have less animation deformity. In other words, if you flex your pec, hey, if the implant's above the pec, it doesn't really move or really move hardly at all. There's less risk of capsular contracture, scar tissue formation around that shell or the implant. The shoulders seem to be more stable in patients. And honestly, with the ability to have long term numbing medicine, better understanding of narcotics, we can inject numbing medicine today that lasts for 3 days or 72 hours. So a lot less pain after surgery, coupled with under the fascia, that area has a lot less pain. Patients are definitely able to recover faster.
Yes, absolutely. And everyone's super busy, and that's really important. And I think equally important, the short term is very important, right? Patients want to know how long they're going to be out. But I think probably even more so and more important is the long term outcomes. And I think also when we see how tissues settle, how everything relaxes, and we're talking years and years down the line, decades, we don't have to worry about the implant and the breast being discontinuous. So when the implant is behind the muscle, it's going to stay there most likely, but we may see with aging like descent of the gland of the breast. And so then that can look a little funny versus if the implants are placed in front and they're, right next to the gland of the breast, those are going to age more naturally, more as a unit. So I think both from a short term and a long term, I love doing preservation breast augmentation. And there's also good news for patients who've had their muscle cut in the past. How are you approaching these patients that come in and maybe they're also Pilates moms and they want this, but they've already had submuscular breast augmentation?
Yeah, I think in the past we've always focused on making a new pocket, but to be honest, we're making a new pocket still under the muscle. With the ability to create a whole new pocket, but it's completely above the muscle under the fascia, we're able to repair the muscle. We can create a implant pocket under the fascia but above the muscle. We have 6th-generation implants so that it looks great, it feels great, it doesn't move, and patients aren't really in that much pain afterwards. And it's really been revolutionary to be able to offer patients who have had implants in the past a whole new look with a lot less pain after surgery. What's your experience been?
It's been phenomenal. And so we've been taking these patients. I always offer them repair of their pectoralis muscle. So we're going to retension that once we take that implant out. So we make sure that we're maintaining shoulder function. We want to leave that muscle on tension, repair that, basically get to start fresh. And it's been fantastic. Also, a fast recovery for patients. They're oftentimes doing a lift because we're oftentimes downsizing those patients that had implants placed 15, 20 years ago when the style was a little bit more voluptuous than maybe it is now. But it's just really been tremendous. And those patients oftentimes they're concerned about going in front of the muscle because they've been told for years that they had to go behind the muscle for a number of reasons, and one of which was maybe that they didn't have enough breast tissue. But I've been amazed by this technology and how natural it looks, even with minimal breast coverage. So for the thinner patients, it's been a great option. And for the thinnest of patients, when we're like looking at them and almost seeing their ribs, we've just been adding a little fat transfer for the cleavage lines. And so this kind of hybrid approach that we talked about for breast augmentation has been really fantastic for those patients. So we can go in front and then just add a little conservative volume at the transition from the chest wall to the breast for the most natural results. And that's been really lovely.
Yeah, I mean, it's truly revolutionary. It's pretty shocking that in the space of just a couple months, with the release of Motiva implants and all of the knowledge that we've had with pain control, with fat grafting, with new pocket or neo pocket technology, heck, internal bra, all this stuff, we're able to use all that stuff and boom, actually make a huge difference in the past couple of months for all of our patients.
Yeah, it's been tremendous. And when I talk to people who are on the cutting edge across the country, as we've been at a number of our national meetings the last couple of months. So you always have your finger on the pulse of international plastic surgery. It's one of the many amazing things about you. But really seeing other surgeons who've got predominantly breast-driven practices as well, everyone is quietly or loudly transitioning to this. So amongst, the heavy hitters in our field. So some notable exceptions, but it's definitely has been popular for the surgeons, because I think it just makes so much sense. And you always have to wonder in America, it's like, why are we doing things differently around the world? Oftentimes in the US, it's because we're the leaders and the innovators. And we definitely are as plastic surgeons. But I think implant technology has been something that has been a little hampered here, just because of the storied history with American breast implants and the FDA.
Yeah. And so I'm glad that, hey, we have the surgical techniques down. We have great plastic surgeons. You're super well trained, as well as, at the cutting edge of techniques. But all of us have been sort of held back with the lack of the best implants, and now we have them.
Yes. So it's exciting. I've been enjoying seeing my results with patients for the last 6 months, and can't wait for the next couple of years to go by and just see how they age. It's everyone's been looking really good, the earliest cases that we've been following.
Well, that's great. I mean, it's great to see. It's great to hear from grateful patients. And I know that you and I have many grateful patients with the latest techniques in preservation breast augmentation.
Absolutely.
So for all the viewers out there or listeners out there, if you have any comments or questions about preservation breast augmentation, please fire away below. If you want a consultation, of course, definitely check out Dr. Hamilton in Houston or myself here in San Francisco or Beverly Hills. And if you have any future topics, please let us know. And finally, Kristy, as always, stay beautiful.
Stay beautiful.
Thank you for joining us on The Beauty Scientists. Be sure to visit thebeautyscientists.com and learn more about modern beauty and connect with Dr. Hamilton and Dr. Kim.